You know, there's this massive difference between building a country's hardware, like its roads, its bridges, and power plants, and building its software, its people. Today, in this explainer, we are diving deep into social infrastructure and looking at exactly why human capital is the absolute true engine of any developing economy.
All right, here's our roadmap for today. 1. The engine of human capital. 2. Education and skill development. 3. The state of Indian healthcare. 4. Family planning and demographics. 5. Housing, a basic human need. And finally, 6. Impacts of weak infrastructure.
Let's jump right into Section 1, the engine of human capital.
Think of it this way. Economic infrastructure, like energy grids and transport networks, works from the inside to build physical capital directly. Social infrastructure, on the other hand, works from the outside. It raises the quality of human resources. You can literally have the absolute best physical tools in the world, but without human capital, you can't use them efficiently.
And this human capital, well, it's built on 3 main pillars: healthcare, education, and housing. Together, these don't just keep people alive. They supercharge labor efficiency, they fundamentally shift social outlooks, and ultimately, they add massive productive capacity to an entire economy.
Moving right along to Section 2, Education and Skill Development.
So, here is a really crucial distinction we need to make right off the bat. Education is not the same as literacy. Literacy is just the baseline ability to read and write, right? Education, though, is the much wider process of actually developing specialized skills. Because of this, we can safely say that all educated people are literate, but definitely not all literate people are educated. But we do have to start with literacy to see the baseline progress. And historically, the growth here is just staggering. We're looking at a leap from a mere 18% literacy rate back in 1951 to over 81% by 2013. That is tens of millions of people gaining a foundational life skill over just a few generations. Incredible, right?
However, that huge numerical growth kind of hides some serious system-wide deficits. For instance, there are severe quality concerns in rural areas and a massive skill mismatch that's leaving graduates completely unemployed. Add to that a persistent funding gap, with the government spending only about 3.8% of GDP versus their 6% target, plus expensive privatization, and you end up with a really deep wealth gap in who actually gets to learn.
Let's look at our next pillar in Section 3, the state of Indian healthcare.
When it comes to healthcare, the system relies on this 3-tiered ladder. It starts at the grassroots level with primary centers in the villages. Then, if things get a bit more complex, patients move up to secondary district hospitals. And finally, the most critical cases are sent to tertiary care. These are your highly specialized research colleges and massive urban hospitals.
And over the decades, the sheer scale of physical expansion across all these tiers has been massive. Just look at this. Government hospitals grew from under 3,000 in 1951 to over 23,000 by 2017, with the number of beds increasing nearly 6-fold. This massive infrastructure push successfully drove down national death and infant mortality rates over the last 70 years.
But, and this is a big but, just like with education, all that physical expansion hides a massive personnel hurdle. Wrap your head around this. In India, for every 10,000 people, there are only 2 doctors. Just 2.
That stark shortage naturally feeds into a vicious cycle. Without enough doctors and nurses, rural areas face severe infrastructure gaps where life-saving equipment literally just sits completely unused. This creates a highly inconsistent quality of care, making reliable, affordable medicine incredibly difficult to access, especially for the most marginalized populations.
This brings us to Section 4, Family Planning and Demographics.
I think Dr. Chandrasekhar perfectly captured the core mission of family welfare in India when he said, "Don't delay the first child, don't hurry for the second, and avoid the third. It's all about having children by choice, not by chance." Spacing out births protects the mother's health and ensures every single child gets the maximum attention and financial security they deserve.
And honestly, the program has achieved monumental demographic shifts. The total fertility rate, which is the average number of children born to a woman, has plummeted from 5.2 back in 1971 all the way down to just 2.2 by 2020. That is a game changer.
Yet the reality on the ground remains a total uphill battle. Poverty is the ultimate hurdle here. For a struggling family, more children often just mean more hands to earn an income.
Add in the compounding challenges of illiteracy, fatalistic beliefs, a lack of cheap contraceptives, and, yep, that same shortage of medical staff we just talked about, and the sheer complexity of this issue becomes crystal clear.
Now, for our final pillar in Section 5, housing, a basic human need.
Proper housing isn't just about having a roof over your head. It completely dictates a worker's ability to rest and actually be productive. Between 1971 and 1991, India saw a really steady increase in solid pucca housing, houses built with sturdy materials like cement and brick. Rural pucca houses jumped from 18 to 31%, and urban areas moved from 64 to 73%.
But against all that progress, we have to face a pretty staggering reality. It is estimated that 78 million people in India are still completely homeless today. And for those who do have shelter, the conditions can be truly dire. Rapid urbanization means slums now account for a quarter of the urban population. Just imagine this for a second. 44% of all urban families live entirely in one single room. And out in rural areas, only 19% of households have something as basic as safe tap water.
Which brings us to our final part, Section 6, Impacts of Weak Infrastructure. When we bring all these building blocks together, the compounding cost becomes glaringly obvious. A country can build thousands of factories, they can import cutting-edge machines, and lay down endless highways. But without a healthy, educated, and safely housed workforce, all that physical capital is essentially useless. Weak human infrastructure acts as an impenetrable ceiling on a nation's economic development.
Which leaves us with a really provocative question. If every single piece of physical capital is completely reliant on the human beings operating it, are we even measuring the right things when we judge a country's progress? I want you to really think about that the next time you look at global development. Thank you so much for joining me for this explainer, and I hope it gave you a powerful new lens to view the world.